Hi, Dave Sheehan here from The Connect Show. In this upcoming episode, I'll be speaking with John Gibbons from the UK, who provides courses, writes books, and has over 140,000 subscribers to his YouTube channel, which offers close to 400 freely accessible assessment and treatment videos for manual therapists. Stay tuned.
Okay, now that we've addressed all those beautiful trigger points in the medial compartment, I'm going to show you how I go about treating the area after I've worked that. So linking it all back up together, exploring some of the range of movement through there and the tissue in and around that area as well. I think it's so valuable that once you've done this trigger point work that you need to sort of try and feel what sort of tissue is left over in terms of potentially hypertonicity, and there's no doubt with most of this work, we're not just looking at specific areas. We want to link this tissue all up together. We want to explore what sort of range of movement, and as I said, that hypertonicity in there as well. But I'm going to show you how I do it from the point of view. I have a two-prong approach, okay, and it's all about pressure, it's all about speed, and it's all about movement as well. So we're going to put a liberal amount of cream into this medial compartment to start with. Make sure that you bring the leg over so that you can get a little bit of inversion going, a little bit of dorsiflexion and a little bit of plantar flexion. So that's the sort of the area we want, or the range of movement we want to explore. Now, where we're working is medial, obviously in that medial compartment, so off the tibia itself, okay? So the first approach is going to be an open hand, and we're going to basically focus the pressure in and around this area here, okay? So that thenar eminence almost, okay? Come down where the medial malleolus is, and the idea is that I come down and I sink into the tissue like so, okay? And I'm going to be working at this speed. It is so important that your speed is not fast. So the deeper you work, the slower it needs to be, okay? And when I say this from the point of view, you try working deep and fast on your clients, first thing that will happen is that they will start to contract and push you out, and that is not what you want. That is the opposite effect of what you want. So we're going to work down, like I said, broad approach. I can introduce a little bit of dorsiflexion, introduce a little bit of aversion, and work right along that medial compartment where I've been working and addressing those trigger points. So flexor dig, tib post, even all the way up into popliteus. Okay, so explore that approach again, like so. A little bit of plantar flexion, a little bit of aversion, medial head of soleus, working up, pushing in. You pick up even a little bit of the medial head of the gastro, once again all the way up, and you can see the speed that I'm working at. Okay, now I'll come off there. Now I'm going to use a loose fist. Okay, so same approach, but what we're going to do here now is that as we sink in, we're going to put a lot more of the pressure between the first and the second knuckle. We're going to guide right along the medial head, okay, of that soleus again, and once again we're going to sink in. Once again, make sure that the pressure's okay. That's all right, James? Yep. And then we introduce that movement again, all right? And then we just work slow, deliberate, and purposeful. So especially as we come up, we're picking up a lot more tissue up here now. So once again, we'll slow it down. Absolutely in no hurry whatsoever to work this tissue. We want to make sure that we're covering it all and being deliberate and purposeful. What we do, come back down again. Same scenario again. And that is literally the way that I link up this tissue. And for those that are coming in for medial tibial stress syndrome, like shin splints or the plantar fascia, then we address these areas, we get them back up, we get them to do some calf raises, maybe some hops to try and reproduce their symptoms, see if we get a change. And that's it. So that's linking all those areas together.
Hi everyone and welcome to Connect. This is Dave Sheehan again. I've got a really interesting guest on the Connect show today, John Gibbons from the UK. Welcome, John.
Hello, and thank you for inviting me onto the show.
You're most welcome. Now, John Gibbons is not only an osteopath lecturer and author in the UK, but is also recognised as the expert in the field of manual therapies, largely due to the success of his Bodymaster treatment method. He regularly gives training sessions to therapists working toward the Bodymaster qualification, and he lectures in sports medicine and athletic performance at Oxford University. When he's not training and lecturing, he works with professional athletes at his Bodymaster clinic in Oxford, and we'll ask John a little bit about that as well in the interview today. And he's also chief osteopath to the Oxford University Boat Club men's heavyweight rowing team. John's dedicated to his professional life to learning as much as he possibly can in manual therapy, and as a result, he's qualified in a number of different disciplines, including osteopathy, spinal manipulation, acupuncture, sports and remedial therapy, personal training, and nutrition, just to name a few. So once again, John, welcome.
Thanks. Thank you.
But let's talk a little bit about your website. Now, I've had a chance to have a good look through it. And the other thing that I want to talk about is your YouTube channel. Because originally when I first came across yourself, John, it was through your YouTube channel, which is just an abundance of information, free information. Yeah. So firstly, with your website, interestingly, you run a clinic as well. And we mentioned that you're an author, and we'll talk about your books as well in a second. But so you run a clinic, and you're also you're a teacher and instructor in your special qualification as well. So the clinic is serving the general public. Would that be right?
My clinic is based at the University of Oxford Sports Complex.
Okay.
So that would be basically the students of Oxford will have access to the clinic. So the clinic has been set up for 18 years. So it's primarily a clinic for Oxford University students and staff. However, anybody can come and see us because we have osteopaths and physios and sports massage, sports therapists. So, but probably around 80–85% of patients coming in on a day-to-day basis will be coming from Oxford University, whether it be a student or the staff.
Okay.
And that's where my clinic is based. But also within that clinic is where I do a lot of the teaching as well.
Okay, well, that's handy. It's a multi-space for you.
Yeah, so I've probably got 4 or 5 rooms, and also got like a main teaching clinic room. I try, if I can, to teach courses out of term time. So the students of Oxford will do like an 8-week block and have a break and have an 8-week block. So when they have a break, I try to do a lot of my teaching, so it doesn't interrupt the students and their treatments, etc. And it seems to work quite well. The problem is now the clinic is closed since March.
I was going to ask you that. Yes, there ain't too many clients around, patients around for you at the minute. Yeah.
No, which is a shame. Not so much for myself. It's more with my staff, because obviously I had an osteopath, and in reality, if you've got no students, there's no patients, and if there's no sport, there's no injuries, which means there's nobody to treat, which means there's no money. Yeah. So obviously life gets affected, and before you know it, you're looking for another job. And a lot of my staff are doing other stuff.
And again, all over the world, manual therapists are hurting for the same reason. It's it's very difficult. Now, with the Bodymaster treatment method and your qualification, did you want to tell the folks at home a little bit about that?
Yeah, so a lot of people will say to me, what is different with your courses compared to somebody else? And it's a tricky question, to be honest, because my Bodymaster method is not like you have come on to the shoulder joint course. The idea is that over time, and that could be 6 months, it could be 2 years, that you slowly do one course at a time. And what I like to believe is when people come to me, they get a book. So for instance, if you attend my nerve course, then you will get a book that I've written as the course notes. Mm-hmm. And a lot of people like that, because I believe there's nobody else in the world, and I know most of the therapists around the world, that will physically give the student a book that they've written as part of the studies. So I try to amalgamate all my 20 years of experience into a course. And then people say, well, John, I'm level 3. What course level is yours? And I go, well, I never say it's a level. It's not like a level 5 or level 6, But what I do believe is that when you come to me, whatever level you are at, wherever it's a level 3 or 4, I will take you to another level. And my courses are pretty intensive. Like I used to run a 5-day course just on the pelvis, and one of my books on the pelvis is about 100,000 words. So I try to teach as much as I possibly can about that subject. And I would say that I spend most of my day writing, researching, reading. So I'm constantly doing therapy all day, every day. So I do hope that when students come to me, they could be a doctor of physical therapy, they could be an osteopath, it could be a chiropractor. Then, obviously a lot of people will try to challenge me in terms of my knowledge, but I hope to think that I'm able to answer the majority of the questions that they get asked. But I also try to look after the maybe the level 3 sports massage therapists who might not have the knowledge. And so I still try to interact with them and try to bring everybody up to a certain level, and it seems to work quite well. And then once they've done one course, then typically that student then will book onto another course and to another course. And eventually, once they've done the 10, which encompasses the whole body, then they have to do a booklet, and then they'll get the Bodymaster Method Practitioner Award, and then they can go onto my website. And then people every day will say to me, John, I can see your YouTube videos. Who have you trained? Yeah, I live in California. And do you know anybody who's local to me? And I go, like, I know people in Australia. And people say, do you know anybody in Sydney? And I go, yes, I know someone in Sydney, Mark Bray, for instance. And I might say, well, go and see him. Yeah, because he's trained under my umbrella. I'm not saying he's done all my courses. Yeah, but I'm hoping he'll have a concept around what I'm trying to achieve. And it seems to work.
I was just going to say, sorry, carry on. Go on. We've got a little bit of a delay. Go on.
Yeah, in my prime, I used to teach, as in like just before lockdown, I should say, in March, I was averaging around 200 therapists a month. Yeah, I was teaching. So, I was probably teaching 10 courses a month, and the numbers were probably 15 to 20 in each course. So I try not to teach too many. I try to limit it to around, well, I said 20, but in reality it's around 16. Okay, so it's so I try to give 1-to-1 if that's possible, and it seems to be okay. Like Mark, for instance, it was an interesting concept, but I teach in Oxford, and Oxford to London is only an hour, give or take, on a train. And then there was someone on the course who said, "Oh, John, I'm not sure if I'm going to come again because it took me 2 hours to get to you with the traffic, etc., etc." And then the Australian Mark said, "I've just got off a plane from Australia, and I'm only doing this course for 2 days. So physically I've been on this flight for, I don't know, 20 hours." And he went, "Oh," this guy from London said, "Okay, I'm not saying anything else." And also on the same course, there's a lady from Canada and somebody else from Singapore. Yeah, so I almost had more people from other countries than I did from the UK.
Yeah, for sure. Yeah. Now, I do want to say to everyone at home, as I mentioned, John, the first time I met you, from a sort of an internet point of view, was through your YouTube channel. I highly encourage everyone to head over and check out the YouTube channel. It is chock-a-block. You've got over 144,000 subscribers and over 350 videos that range from assessment, kinesiology taping, kinesio taping, and as you said, assessment treatment techniques. It just covers absolutely everything. It's quite amazing. What are some of your favorites that you've done out of all those over 350 videos?
Yeah, well, actually, there's 368 because I've been adding. I'm trying to be more active on YouTube. Yeah. So I've got 368 now, and I've just literally about a month ago we did another batch of videos because I've got this amazing videographer who comes and does like 20 to 25 videos in one day, and then he edits them. So I've got another 25 to upload. My kinesiology taping on by far my most popular, as in like in the millions. But I quite enjoy doing the more nitty-gritty lessons, like about the glutes firing, the hip. The hip joint fascinates me. So many people, always email me saying, "Oh, John, my glutes hurt, or my lower back hurts, or my knee hurts," and I'm saying, well, typically I'll send them the video on the one of hip joint pathology, and I'm saying, well, have a look at this first, because if you have a problem within the hip joint, like a labral tear or an impingement of some sort, then it can be like a source of referral. So the glute pain might be from the hip joint, the knee pain might be coming from the hip, and and videos like that I quite like to do. And I've got quite a few on case studies of the nerves, which I haven't uploaded yet. So I'm just in the fine-tuning element of that. So I'll be doing some of that. But you're right,
that book that you showed, sorry, just to butt in, that book that you've just showed us there on the nerves, that's brand spanking new, right? That's just been released?
Yes, yeah. In fact, you can't physically buy it and receive it yet. You can buy it or pre-order, and I think it's just gone to Terra Rosa in Australia.
Ah, good goodie. So, yep, fantastic. Good plug.
Yeah, so he's just told me he sold about 40 on a pre-order. So I think it comes to you, yes. But this is the hardback version. But literally, I would say it's my best book to date. But the pictures are in there are pretty. I'm not sure you can see that.
Yeah, we can kind of. Yeah.
So, and then it's not drastic money in England. It's 20 English pounds, about 21, 22 euros. I'm not sure what the price would be in Australia. But I think it's remarkable, some of the images on there. Because it's not an easy subject to write, because I'm not a neurologist. So I'm trying to write it for people like myself that trained as an osteopath. And when the neurologist was teaching me, within probably 10 minutes, I was like, whew, the knowledge base was far too great. And at the time, the books on nerves were still heavy going. So then I think I want to try to write a book that makes sense, not just to the PhD doctors, but to sports massage therapists, sports therapists, because when someone says, "Oh, my arm hurts," then is it coming from a neurological pathology from a cervical spine, or is it as a result of something local, like a carpal tunnel syndrome, or maybe the Guillain canal in the hand, and it's just trying to work out things like that. But whichever way you look at it, just by mentioning that word nerves, people go, ooh, I think I'll do that course another time. But actually, my online courses, which I run 7, the nerves is the most popular, which I'm really pleased at.
There you go. And so people can access those online courses via your website. I've got the website here on my other screen. So that clicks across to an online learning platform. So all of your courses are listed there and obviously accessible via the internet, which means that Australians can access them. So what other courses have you got? I think you got MET, you've got a few others there.
Yeah, so like the lockdown for a lot of people was a problem. But, I thought, well, from March onwards, I had to postpone courses like from March to April and April to May. And it just went on and it went on. But then in the meantime, I was thinking, well, what could I do in my time? Because I'm quite good at doing things. I hate just sitting down doing nothing. And I thought, well, why don't I design an online course? And a friend of mine, SJ, a friend from Scotland, and she said, John, you need to try the Kajabi website. And I didn't really understand it. And I didn't really want to do the online stuff initially because I thought, well, how can you learn if you're not physically with me and I'm showing you and guiding you and all the things that go with that? And then I initiated a muscle energy technique course. And then we tried it. And then it encompasses the book for one, so you get all the chapters.
Brilliant.
And it's like 1 hour CPD. And so yes, it's not me physically teaching you face to face, but then each lesson, like for instance, the MET, I think it's 9 or 10 chapters in there. So each chapter will be the lesson. So it'll be like 9 lessons split into say something like 60 modules. And then after each lesson, you'll then have like an assessment, a multi-choice where you have to get 100%. And then once you've done that, you then go into lesson 2 and so on. So I do think you probably would learn a lot more, doing the online platform, because when you come to me on a course, it might be 6-7 hours, and then we have lunch and we have a break. And then when I ask you at the end of the day, maybe let's discuss what I went through at 10 o'clock this morning. A lot of people will say, I've got no idea. I didn't record it. Yeah, and I can't remember what we did, especially like K-taping. If I said, show me the second technique on knee pain, yeah, they'll go, John, I'd have to watch the videos again to do that. And the good thing is with the online is that you can go back time and time again because it's lifetime access. And I'm slowly adding videos that are not on YouTube. So you might think, well, all your stuff's on YouTube. It's not. It's incorrect because I'm slowly adding extra videos onto the online platform that you cannot access, and not like all of the assessment questions. But I've got 7 courses online. So that's the majority. Like I've got the pelvis, I've got the shoulder, I've uploaded the nerves, the cervical spine is uploaded, the K-tip is uploaded. So there's 7, and I'm literally, for the last 2 months, I've been doing the vital knee complex. The problem is writing a new course means I've got no content. At least like with an MET, I can use my book as the chapter for the lessons, whereas when I'm designing a new course, I don't really have any substance to it. So what I'm trying to do is write each lesson, which means it's like a chapter for a new book. And I've done 15 chapters now. So I've almost like written a book in 2 months, and it normally takes me 2 years. It won't be a book yet because I'll probably add another 50,000 words. And then obviously the editor will come in and do his thing. Yeah. And then the artist and the photographer. So it's just a long, long process. But the knee one will be uploaded this month. Yeah. So November. And I'm looking forward to that one. We did more knee videos recently. So when I go and when I go and access them, because I haven't seen them yet, yeah, I'll be slowly adding them. So, and I'll be a good course. You know, people say to me, John, you've been writing like 2.5, 3 months just on the knee. I go, well, I did 105,000 words just on the shoulder, and I could have done 200,000 words. So yes, it's just on one area.
That's prolific.
Because I always say to my
you're
students,
writing that amount is must be incredible to. Yeah. It's actually there must be so much content within those modules. Yeah.
Yeah. No, I'm trying to cover. It's like like if I talk about the shoulder, then it's fine. But obviously the shoulder relates to the cervical. Yeah, because naturally shoulder pain typically comes from the cervical and vice versa. It's very like a marriage. Yeah, if you have a problem with A, you've got a problem with B, and you've got a problem with B, you've got a problem with A. So if I talk about one area, so if I talk about, say, the hip, I would need to incorporate a little bit about the pelvis, a little bit about the glutes, and then treatments, the soft tissue treatments, yeah, using the fascial wax I use. Then obviously tape-in techniques. I like tape-in, especially athletic tape-in. So I try to show, a lot of it is old school, like the knee, the McConnell regime from a physiotherapist. She's Australian, called Jennifer McConnell. Yeah, so I utilize a technique that was taught to me. But not many people know of these techniques because most people are in the mindset of using the color tape, which is fine, and I do it very well on my YouTube videos. Yeah, but I think sometimes the old school stuff, like I was in the military, I was a physical trainer, and we would use the zinc oxide athletic tape a lot of the time, to stabilize the ankle, and I've used it when I looked after rugby teams, but not many people utilize that technique anymore, so which is a shame. So I'm trying to bring that back in a little bit, yeah, if I can. Yeah. I'm not saying old school, but I think it's been lost a little bit. Like I was taught by a US physical therapist, athletic trainer, I should say, called Ron O'Neill. And he's like a magician type, and he looked after all the Super Bowl teams. And I was fortunate to be almost taught by him one-to-one. And it was like, Ron, I just need to slow you down because you tape ankles so quick. It is just ridiculous. But then he says, John, I tape every athlete before every training session and every game because of insurance. I go, that's just unbelievable. Whereas in UK, we would normally tape. My friend Michael would say, "Oh, John, can you tape my ankle? Yeah, before the game." I say, "Yeah, that's okay. I can do that for you." But I probably wouldn't do it every single game.
So and that's a training as well. That's pretty amazing. Again, people at home, you guys can get a taste of all that through the YouTube channel. And then if you feel like you're wanting to go that little bit extra, then you've got those fantastic online learning modules. John, we're going to leave it there. We've run out of time. At the time of this filming, you guys are just about to go, or you have just gone into lockdown. So wishing you all the best over in the UK. Hopefully we'll get to see you out in Australia one day. You mentioned Terra Rosa in Sydney, Buddyman.
Yeah.
So hopefully he can coax you out to Australia, and we can see you in the flesh and get you running some courses here in Australia.
Yeah, because a lot of my colleagues come over and teach there, like John Sharkey's there quite often. Yeah, and I know him quite well. Yeah, so especially as I like Irish and I'm from Wales. Yeah, so we have a nice little bond together. But yes, I'm sure I'd love to come over. Yeah, because it's on my to-do list, if you like. But maybe not next month or two, but hopefully next year when things calm down.
Well, maybe if you're allowed in the country at the end of next year, I think the way things are going at the minute. But anyway, we'll see how we go.
We'll see how we go.
All right,
Perfect.
John, again, thanks for your time today. Really appreciate it. Thanks for being on the Connect show, and wishing you all the best. And once again, hopefully we'll see you out here one day.
Okay, perfect. Thank you.
Thanks, John. Cheers.
Have you considered becoming a certified specialist? It's a tangible marker that your services meet nationally recognised standards of excellence, enabling the public to make informed choices when looking for a massage therapist or myotherapist. The opportunity to become a certified specialist is open to all therapists nationally. For more information, visit massagemyotherapy.com.au/certification.
Hello from Associated Bodywork and Massage Professionals, the leading association for massage therapists in the United States. I'm Leslie Young, and I'm ABMP's International Ambassador. I'm so excited about our new partnership with Massage and Myotherapy Australia. Now, MMA members can join as ABMP Associate members at a deep discount and access more than 200 hours of online continuing education and other member benefits. So for more information, visit abmp.com/MMA. Together, we look forward to supporting you and your career.